Hello. It's been a wonderful start doing this series on research process. I've got some overwhelming feedback regarding the content itself, as well as you can see today the format or the frame of my camera is quite fit for the type of platforms we share this content on. So before we move further, today I'll be very brief. There is a section of our audience who would like to understand the issue or the aspect of knowledge gap or research gap. What is it? Because you need to prove why you need to do your research. First of all, if you're seeking for funding, do we need another research, or we can simply read what is already been done? Doing another research sometimes is costing a lot of money. A lot of research are going into it. We have a lot of time spent on the same. So we need to see if we need a new research, or we can simply review or look at what is already existing by just reading the already published evidence about a specific problem. Now that informs what I'll be highlighting today. I'll take the shortest time possible before I can go back. I'm doing a paper on some problem in urban centers. I'd like to finish that and probably share with the world very soon. Now, talking about research gap, some people call it literature gap. Depends on how you're approaching it. As I have always mentioned in this series, is we are talking about from academic point of view in institutions of higher learning, or could be in an organization, whether government or not for profit, or even the private sector. So all the audience are covered here. So if you're talking about research gap, you need to bring that out. Remember, when we were introducing the research process, we were talking about making sure your problem is understood using statistics, using past studies, or trying to identify what are the research gaps in the previous studies. And in that case, you will not just go to highlight that this study was not done well and I want to do a new research. What do you mean not done well? What makes you think you will be the one to do it well? So those are the questions you need to answer. And there are pointers to what is a research gap, or what was not addressed that I want to address in whichever problem you are addressing. So let's for instance look at evidence gap. Evidence gap is we have some research findings from previous studies, but now these findings are contradicting the widely accepted conclusions. So we're saying there is some evidence gap here. Probably you could have discovered something new in your research, but we need more research to prove that that is the case, or yours was having some gaps resulting in contradicting evidence. So that simply means we need another research that is done not using the same design or approach, probably something different, to see if the results will be consistent with what is contradicting the widely accepted conclusions, or the new findings will reinforce the widely accepted conclusions. So that is one part of research gap that you can look into. Now we have something very interesting, another type of research gap that you can look into. What we call a practical knowledge gap. Practical knowledge gap, we are saying let's say the professionals in whichever sector, could be health. I've been trying to use the transport sector, could be education. The professionals behave in a certain way. When you observe them at work every day, there is a way they behave. If you want to look at, let's say, we were highlighting an example of traffic police officers on our roads, then their behavior is not consistent with what is advocated for, or the advocated behavior. So the advocated behavior could be, we expect the traffic police officers to support easy movement of traffic, to address any problems that emerge on the road, to be always readily available on call when there is an emergency. But if you observe the trend, that is not what is happening. Probably when you call them, they will say sort it out with the person you've involved an incident with, or they're saying, I'm with my family, that is not a priority. So that is now their actual behavior, or their real behavior, their practical behavior when at work. But what is advocated for, what is written down, is something different. So we're saying there's a practical knowledge gap. In health is very interesting, and probably in future we shall be doing something on the same in terms of bringing out a scientific paper. We're saying, for instance, we expect the doctors to uphold the highest ethical and professional standards, the highest, because it's a matter of life and death. You don't expect a health professional, a doctor, to love money more than they are expected to protect life. So life comes first. But if it happens like the cases we've had before in our society, where you rush a patient to the emergency sector and or department, and you're told you need to pay first before we can allow you in. So here we have a situation where a patient is on the verge of death, but the health professional is telling you, without money, we are not admitting that patient. Wait, or start solving that with your family before we can admit the patient. So it moves from being, the scenario moves from being an emergency to now business. So what is happening, the actual scenario is, doctors are not behaving based on what the practice calls for, what is advocated for, that a health professional will prioritize health, life before anything else. So that is sort of a practical knowledge gap. Now we want to find out, if that is what is happening, how can we address it? First of all, we want to protect life. At the same time, we want to protect someone's business, because health, it's also business, particularly in the private sector. Even in public sector, there is a business element in it. So you're saying, yes, we can admit you, but how can we guarantee that our business will continue beyond your health issue? We shall continue to serve other people. What happens if you admit you and then you don't pay eventually? So someone is serving, and that someone needs to take care of their bills and all that. So how can we establish a balance, but at the same time prioritizing life? Now that's what we're saying. We are trying to establish new findings or new evidence that will help us to address this issue. And I really wish this can be addressed both at research and policy or practice levels, because it's becoming a big problem. So that is a big thing that you can look into in whichever kind of research you wanna do. And then I had started to talk about, let's say, a methodology, the technical bit of research. Methodology varies. The way I had highlighted, for instance, when are you applying a longitudinal design? When are you applying cross-sectional design? when are you applying a descriptive design? When are you just doing a qualitative research where your interviews and focus group discussions are sufficient? And when are you doing entirely a quantitative where you, let's say, administer questionnaires to your audience and you have quantitative insights, you are communicating that. When is quantitative enough? It can stand on its own. When is qualitative enough? When do we need mixed method? Mixed method is you're mixing both quantitative and qualitative. So if you're doing a research that needs some, let's say what I've just mentioned, that the doctors are not behaving according to what the practice calls for, then we want to establish what do they think. So we just don't want to count that 30 doctors are not behaving according to the practice. We want to establish what do they think. They can give us their opinions, what they think can be the solution to this problem. So that simply calls for incorporation of qualitative insights. People are narrating their experience with bad patients or good patients, and then you are recording that and communicating that evidence. So what we're saying here is the qualitative aspect is very important in getting the insights and opinions or experiences of the doctors in that specific scenario. So if a previous study has been done and no insights from doctors were derived qualitatively, then it has simply established a methodological gap. That findings were derived, yes, but there was a gap in how they were collected. They were not comprehensive enough to address the problem. Probably a research was done and it has ended up recurring. Very important. You can look into that. We have empirical gap. Here we're saying the research findings just needs to be verified empirically. For instance, you've done your research and to try and establish if the findings are reliable and valid, then you are just verifying with what has already been done before. Is it consistent? Is it varying? We are not saying it should be the same or it should be consistent. That is why we do research. We're saying it can vary. So what is the source of variation? So it's sort of verifying empirically using the already done or prior research. Now we have something very interesting in addition to that, what we call theoretical gap. Theoretical gap, every research is guided by some theory. For instance, you look at what I've mentioned, at the doctor-patient kind of relationship, the health sector, the business, the patient, the doctor, that kind of relationship. You can establish a theory, let's say collaborative theory. I believe there is such kind of a theory, collaborative theory or stakeholder theory. So those theories are guiding the research process. How are these various stakeholders in this problem collaborating? So you see how you're developing your research based on that theory of stakeholder theory or collaborative theory. Now, we could have a communication theory aspect of it as well. For instance, how are the patients communicating with, or the caregivers of that patient communicating with the doctors or the management of the hospital, that they can allow the patient in and then payment can be sorted out later if it's an emergency. So that is the communication theory, a model of communication. So you see, those are theories that you can use to develop that research. But we can have a theoretical gap in that you've used, I don't want to call it a wrong, let's just say a misplaced theory in that place. Let's say, I don't know, let's take an example of partnership theory. You've tried to develop that research based on partnership theory, yet this is more of collaboration or communication issue between the different stakeholders. So if you establish If you try to use inappropriate theory, then it rolls out to develop or derive inaccurate findings. Findings that could be correct, but just in the wrong place. So that it's a fine line of difference that you need to address. So very important as well, understanding which theories inform your research. If you want to know more about theories and how they are used to develop research, always feel free to reach out or give us your comment in the comment section. And then finally, we have population gap. Population gap, you've done your research, let's say in some remote area of Dodoma. Let me take an example, or Arusha. Arusha is a nice town. You've done some research there, and then you want to make a conclusion about the entire East Africa using that specific remote area you did in Arusha. We are likely and most likely to have significant demographic differences between the residents of Arusha, the residents of Nairobi, the residents of Mombasa, Turkana, Kampala. So the fact that we have demographic differences in terms of the language they speak, their cultures, their belief systems, how they coexist in their neighborhood, it's likely to vary significantly sometimes. And those who live in Nairobi or in these big cities, you can tell if you live in Nairobi city and then you move to, let's say, Mombasa or Kisumu, or some remote town in Isiolo, there is very significant differences between how we are running in Nairobi, how we're waking up at 5 a.m. to go to work. And those who live in Isiolo or Mombasa, I was in Mombasa sometime, and at 8 a.m. The shop was not open at 8 a.m. in the morning. So I was asked, where are you rushing to? For them, life is slow. You're not rushing anywhere. So those differences matter a lot in research. How are you addressing them in terms of population gap? Nevertheless, coming back to the main point, if you've done your research in Mombasa, it is not likely to give you same findings, or you are not going to generalize that to the people in Nairobi, Arusha, Kampala, because of those demographic differences I have highlighted. So it's good to say this research has been done in Arusha, this research has been done in Kampala, but we've not seen the same in Kisumu, which is, let's say, at a city with unique demographics, a city in a different country, a city in with, let's say, very varying population demographics in terms of gender, in terms of ethnicity. So those factors come into play a lot in saying it is now necessary to replicate this research, not the findings, but the research needs to be replicated in this specific context. So with those few insights about research gap or literature gap, I hope I help you a little bit to understand how to approach and develop a research problem for yourself or for the organization you work for. For yourself, of course, in the academia, and for the organization if you are working on some proposals or for funding. Others call them protocols, others call them proposals, so it doesn't matter. The process is the same. Establish a way to communicate your knowledge gap or your research gap. Do it. If you need assistance, study, research, and analytics is there. We can help you the best, as we've always done. Watch out for more content. Next time, I think I should start to talk more about the analysis bit, which we do a lot. Analysis of these evidence we've collected in the field. whether in the field, desktop, or just online scraping of data. See you next time. I hope you enjoy.